welcome to the podcast. I am Dr. Sam. With me, Dr. Robert. How are you?
Hey, Dr. Sam, how's your morning so far?
Good, good. Today's been pretty calm, so that's nice. And
I'm just,
yeah, usually I'm running around like crazy Thursday morning, so I just wasn't too bad today.
it's good. I'm glad you have like a relaxing day for once because I feel like with small children, life is always chaos.
Yeah, it's a little
So,
bit chaotic, yeah. Especially like towards the end of the school year, like things just seem to pile up, which is happening
okay.
now. So
All the kids excited for summer break?
yeah, I'm not that excited for summer break.
I am not excited.
Actually, no, we have the person who comes and helps us with them is like she's like part of our family and we love her so much. So I am excited for her to come back. She's great. She's a good
Cool.
calming influence on all the kids, which is nice. Um and then they do a lot of camps and a lot of fun stuff. But it's just a lot of like keeping track of where everybody's going and that sometimes can just be a lot. But it's fun. And I actually love the summer, so I'm actually excited for like warm weather and long days. So that's that I
Gonna
like.
be- So you have San Diego weather for a little while, so that's good. So
Exactly. Yes. I get to live your reality for just a few months.
you're welcome.
Thanks.
Cool. Well, I'm excited to talk about our current conversation today. Sounds like it was a case related to what you had recently.
Yes, yes, yes. So I feel like so many times whenever we have our conversations, we're always kind of pulling from things that we're seeing. And I had a patient this week that underwent anesthesia. We did a dental or a comprehensive oral assessment and treatment.
Like
And
the one
come on.
term
Yeah, yeah, there you go. Exactly. Got to say it the right way.
I
Exactly. It's not a dental. But anyway, no, but this dog going into it, I knew, there were some things that sort of made this case a little bit different than my normal ones. One, she was pretty old, which age is not a disease process, but certainly a lot of comorbidities come along with age. Thankfully, she, had a healthy heart. She Her blood work all looked really good. Physical exam, other than the fact that she just had a tooth fall out of her head. And so she needed a dental.
dogs.
Uh, yes. But she's had IBD and it's been fairly well controlled. So that's inflammatory bowel disease. So going into anesthesia, I was sort of like, ooh, I think that we may have some complications after surgery. And that's sort of what we're talking about today. So, what are some of the common things that we see after surgery? And this is definitely something that overlaps me with you and I think, because a lot of the surgeries are done with me, in general practice. And then people see some of the things that can go wrong and end up with you. So,
Absolutely. I think this is a good. I'm excited for this one because there's just a lot of overlap between the two of us, and
yeah,
it's good just to tell people that this stuff does happen.
right.
It's not. I'm not to say it's like rare and never happen, like or it's not super common, but it does happen to a frequent amount. Especially in the older patients, just because all the age, like you said, isn't a disease. It's just like when you and I fall down now instead of like your 5 to 7 year olds, like
Right.
they bounce right back up.
We're
I
not as
need a
bouncy as we used to be.
we just don't bounce back as well as we used to be. The
Yeah.
same thing for dogs. Like they just don't bounce back when they're that old. It just takes them a little longer, and that's understandable.
Yeah,
So,
yeah, and so sometimes they need some help after, and sometimes it happens like a post-op complication. And I mean, we can certainly maybe touch on a few other ones, but I think we were mostly going to talk about what happens when they have some gut troubles afterwards. So we'll talk about that specifically this time, because that's what came up, and it is one of the ones that I feel like I knew going into this case, this was a very high likelihood post-operatively. And I think as anesthetists now, we're taking a lot more care of the gut pre-operatively than we used to. Um, and also really recognizing species differences, right? Like, so fasting a cat, maybe not as long as we would fast a dog and things like that. But certainly fasting is something you have to do before anesthesia, general anesthesia. And and then, we know, okay, so now you've had all this time where, they're not eating just to begin with. This particular dog already had GI issues sort of just underlining. So just waiting to have a problem. And then when we use anesthesia, like when we're doing anesthesia, our anesthetics will affect the gut. And it is something that is actually a normal response, right, to the medications and things that we have. The question is why is it in some dogs they have more of a struggle after anesthesia versus others? Sometimes you can predict it. Like this one, I kind of had a feeling this was going to happen.
Yeah.
And I talked to the owners about it, and it did, and there's things we can do after, which we'll talk about. Um, but like sometimes I'm shocked when it happens too. Like I'm like, oh, I wasn't expecting it in this patient. You know what I mean?
Yeah, and I think bring it back for kind of the first thing you mentioned is explain why like we even have them not eat before
Yeah.
surgery. A lot of times we fast them just because we don't want them to vomit pre-surgery or regurgitate. A lot of times they're under their GI or that's where their sphincters relax that keep their food in their stomach. And so when you're intubating them, the food can come right back up during anesthesia, or while we're intubating them while they're sedated. And the concern is that that food can go into their airway. And that's why
Right.
we don't want them to eat a lot of food beforehand. Some breeds, like you said, or like cats, we have a shorter time between like anesthesia and when they want to eat. And I think there's even some evidence now that like the smush face breeds, they want them to actually eat a little more before they actually have surgery soon too. So there's things like that. We're
Which
still
is so
constant.
counterintuitive, honestly, because they're the ones we worried about aspiration so much. And I
Like,
think that some of those recommendations really have changed recently. Like,
yep,
a lot of times it used to be like, well, just pull their food after dinner the night before, and it's like, well, no, you can like let them have access to food until about midnight or something like that. And even with cats, I mean, when we are doing our dental procedures, we're not doing them until later in the day, usually, just because of the timing. And so, that's a really long time for a cat to not eat. And then, because we're not just taking into account the time before surgery, we're taking into account the recovery after, and then the time before they're going to be awake enough and really even interested in eating. And depending on what you've done, if you've done a dental procedure, if you've done some other surgery that has something to do with their mouth or even their GI tract, which of course sometimes we have to operate on the GI tract, um,
mm,
it can be a really long time before they get any food in them, and that can really sort of mess with their system, especially
yeah,
cats.
absolutely. Yeah, because I think I think that's a big part. Is like that even before we get into surgery, like that's a big part of it. Is like why they might have GI upset, and then like you mentioned, the drugs are probably part two of why they have these side effects. A lot of these drugs not only affect their cardiovascular system, so like their heart and their blood pressure, but they slow down their small intestines, their gut function, so things do not move as quickly, or they even stop them. Something we call ileus.
Yeah.
Um, that's super common with a lot of the drugs that we give, and unfortunately that leads to some of the side effects that we see afterwards.
Mm-hmm.
So it's a lot of fun to deal with.
Yeah.
Really.
Well, and that was really what I think we were dealing with in this patient specifically was that post-operative ileus. So I try now, it's sort of become standard of care, I think, with anesthesia, not just in animals, but in people as well. If you've ever had surgery, I mean, they're giving you about 15 different antiemetics before they put you under anesthesia now, because they're
Yeah.
really trying to prevent this from happening in people. It's
Yeah.
uncomfortable, and we want people eating. We don't want it to turn into a longer hospital stay or any of those things. And so and the feeling of depending on what kind of surgery you've had too, man, if you've just had teeth extracted, the last thing you want is to be retching or
Those.
vomiting, and then you have bile acid in the mouth, which is making inflammation worse. You know what I'm
Yeah.
saying? So it's like all this stuff that you really don't want. Stomach acid, sorry, not bile acid, but you know what I'm saying, like
Yeah.
bile and acid coming out of it. But you know what
Yeah.
I mean. So I think that is one of those things where in hospital there's a lot more we can do because we can give intravenous medicine. We can, that like makes it so that they don't have to be putting something down their throat, because if it just keeps coming back up, also that defeats the purpose of the medication.
Yeah, absolutely. And I think, yeah, like, whether or not it's the medications, you mentioned like prior diseases, which can lead to worse outcomes afterwards or like harsher recoveries.
Mm-hmm.
And like I said, like I said, the type of surgery itself, whether it's an oral surgery just because like it's already in the GI tract, or just like the abdominal surgeries themselves, if you're messing with the stomach or the small intestines, especially the small intestines, anything that looks like a foreign body or mass removal of the small
Oh yeah.
intestines, their recoveries are always just longer for getting back to eating because you're just messing with the gut itself,
Hmm.
uh, causing some level of discomfort, obviously, and discomfort will lead to some of these symptoms as well. So it's those kind of three big things I think will lead to a lot of dogs' prolonged recovery, and that's difficult to manage sometimes.
Yeah. And I've had, I mean, I had one years ago, this poor bulldog that had been sort of, I don't know. I mean, it came to me as a second opinion, right? So you're always smarter when it's when you're the second opinion. So like
Uh,
it will sound like I'm like, oh, I fixed this dog, and it's like, well, I also had the privilege of seeing everything else that didn't work. So
exactly.
grain of salt that. But like, but this poor dog had been having just this chronic GI upset, and it turned out that it had had a foreign body, but in the stomach, like a GI foreign body that finally moved into the intestines and
Okay.
totally blocked the intestines. And by the
So,
time I took that dog to surgery, it had been 6 months. It had 6 months, yeah. This
like
foreign body was,
in this dog for 6 months.
yeah, so the like, because it was in the gut, it was in the GI, it was in the stomach for so long that it kept moving out of the way, just enough that they would like, I guess when they did routine x-rays, they just couldn't see it, which, hey, I mean, that is hard in a bulldog, sometimes because of their conformation where their stomach is, but also too, if it doesn't, I don't remember what it was. I think it was like a one of those discs, I think, that like when you're moving furniture, you know what I'm talking about? So like
Oh,
it
right,
wouldn't
yeah,
have shown up on an x-ray like very easily, because
yeah,
we didn't the reason we went to surgery was because it was like we don't have a choice now.
yeah,
Like, it's been going on so long that
yeah.
at this point, I wouldn't even do it, like, because they were supposed to go and get a barium study at their old vet, but they were
Mm,
going to make him wait 2 more weeks. And this dog was just tanking. And I was like, I don't think you have 2 weeks. Like, I think we need to, like,
yeah,
get in there and do an explorer because there's something really wrong. And, and so yeah, I went in. By then, I had to do a resection anastomosis of the intestine because it had all just died. Thankfully, it wasn't very much. You know what I mean? It
yeah.
was not a very long amount that I had to take out. It was actually the very first RNA I ever did, so I was
Oh yeah.
terrified. Yes, yeah, yeah, yeah. It was early on, in
Well,
our
I feel like those ones usually go the best because you're so worried. I would say in terms of like the healing, like it's so one of the big concerns with RNAs or resections and stenosis is that those sutures will break down at some point, and then if they break down too soon, obviously that's stomach or that contents leak into the small intestine or the abdominal cavity, which is very bad. You don't want that.
yeah, no.
Uh, I feel like your first one, you put so many extra sutures in there, like you test it so many times, like that isn't going to break down at
I was
least.
like leak testing, and I'm like, please, dear God, please, please,
I feel
please.
like that one always goes the best. You're just so worried about it happening. You're just like, I will make sure this thing is watertight.
Yeah. Which is funny too, because once you've relieved the pressure,
Mm.
um, the stomach isn't under. I mean, the intestines aren't under that sort of pressure. Like that, you know what I'm saying? So that even doesn't even like, but it does make you feel better.
Makes you feel better. You're just like, I'm wrapping this up.
Yes, yeah. And but they've done, oh, we can get into that another day, but my
Yeah.
dad my dad told me about, the Halstead studies, or I think it were, where he like figured out the least amount of sutures you need to be able to make an RNA stay in a
That
dog.
would terrify me.
Four.
No. What?
Yeah, that's what my dad said. I don't know. I've never read the study, but
Horrifying.
I was like, that's crazy. But apparently, I don't know. They must be really long sutures. I don't know. I'm not sure. Or really small. I don't know. But that's what that I'll have to circle back with my dad. But I remember him saying that and being like, that can't be. How could that be?
Like, I mean, yeah, you know what? I trust your dad. He knows what he's talking about.
Yeah,
So I'm
I
not
was like, I don't think that's true in people, but I guess apparently, I don't know. That's what he said. But
saying
anyway,
it.
and just because it worked once doesn't mean it would work every time. I wouldn't take that chance.
No, no, that thing's getting at least 20 sutures. So I don't care what's
Oh
what's
my
going
gosh,
on.
that thing's, yeah, no
No.
question. But anyway, so it was my first one, and this poor dog got the worst post-op ileus because she had been sick for so long. Her GI tract had been so compromised. And
Yeah.
even though I could see some peristalsis like while I was in surgery, so I thought, okay, yeah, we're okay. Man, if she didn't just regurge like crazy. And so
Yeah.
she ended up at the emergency clinic for 3 days, I think, where they were just having to keep her on fluids, like a constant rate infusion of something to help kind of move that got along, and anti-nauseas. I mean, it was really touch and go. And thankfully with resection and anastomoses, once you get to 5 days, you can sort of take a deep breath and say, okay, I think this is going to be okay. And so
Look,
she was released from the hospital and started to eat and do well, and then we made it past and she survived. But man, that was my first RNA and my first really dramatic
yeah.
post-op ileus, and it was terrible.
And to emphasize, like the post-op ileus, it's not just about not just eating, right? It's about a lot of times something called regurgitation. If you watch one of our earlier podcast episodes, you'll know what that is.
Exactly.
Uh,
Regurgitation is not the same as vomiting. It's
Thank
not.
you. But a lot of times the regurgitation that is the scary part, because when dogs are regurgitating, they're not protecting their airway, and that will lead them to get aspiration pneumonia, which is a whole different animal, which is just as complicated and difficult to deal with. So that's
And
why when
also
dogs,
is a post-operative complication.
absolutely,
And it's terrifying. Like, I had a dog. I've only ever had one dog get aspiration pneumonia after surgery, and it was a GI, foreign body.
wow,
And we had relieved, I think we had passed a tube so that we got some of the stomach, but man, it just kept, like, there, we thought we had gotten it all, and then just so much came out of the no, it was just horrible. And that poor dog, but the dog did okay. He went to emergency clinic, and they
that's
were
good.
able to nurse him through it. But it was awful, and it was just one of those ones where they're under anesthesia. You do the best you can, but it's a
Look,
complication. And as soon as they had that much you know regurgitation, not regurgitation, I can't think of the word right now, my brain isn't working.
much you said regurgitation. Where
No,
we
but
look,
like under anesthesia, usually we would call it like,
see what you're
okay, I'll come back to it. When my brain
talking
thinks of it in a minute, I'll say the word I'm
it,
thinking
it
of.
will.
I mean,
Like
it's
this,
basically the same thing, right? Like, but it's just like it's not active. You know what I mean? So
yeah.
it's
What'd you say? I'm sure I'll know what you're talking
I
about,
know,
but it's
I
like,
know. It's but it'll come to me. Someone listening is like screaming it right now, like at the like
what are you
that's
doing?
the word. Why can't you think of it? Now, every once in a while, you just like can't recall the
Uh,
word that you're thinking of. That's me right now. But anyway, it's happening more and more. I think I need to start taking a supplement.
Honestly, I couldn't remember my own birthday the other day. Someone asked me what it was. I was like, "What is my birthday?" And I was like, "Why is this? I should know this." I was like, "I
You're
don't know why
like,
this."
that should be at the tip of my fingers.
It's like I should know this one. It was like, "What? I just the brain's a goofy thing.
You
I don't
got
get
too
it."
many, it's like mental triage. You just got too many things in your yeah.
As you get
But
older, you try to
your
forget about
birthday, I mean, why do you even need to know that? Whatever.
He
Doesn't really
wants to know
matter.
that, but
You'd like
oh
to know
wow,
roughly how old you are. It's okay.
I'm
You're like,
20
I'm somewhere in my, I don't know. Me, I'm in my 40s. You're still a baby.
in my mid 30s. Yeah.
Exactly.
um, but yes, you were saying about the term that we can't think about. But anyway, when that
Yeah.
happens, right? You were saying,
Mm-hmm. But when it's happening, you do everything, you do all the right things to try to, help the patient out, but they can still aspirate. And it's not to say that they always will.
yeah.
Just because you have something like that happen during surgery doesn't mean they're always going to get aspiration pneumonia. It just means you really should warn the owners, because it can happen for sure.
Absolutely. And I think it's on. I'll say the younger dogs don't seem to have much of a problem with it, whether it's the post-op ileus or aspiration pneumonia in
Mm-hmm.
general.
Yeah.
It's definitely the older dogs. I don't know if it's just their airway is less secure as they get older. It's like weaker than it was when they were younger,
Mm-hmm.
or they usually have more episodes of regurg than just the younger dogs because,
Mm-hmm.
again, they have a hard time recovering in general.
Mm-hmm.
Uh, but it's definitely the older dogs that'll see the aspiration pneumonias. It's always, they had surgery 2 days earlier. They're coming in because they're not eating. They have a fever. They may not be breathing that hard. It's always just they just maybe had one episode of regurg, and that was just enough to cause them to aspirate.
Yeah, they're punky. Yeah, I mean, it's really, really terrible. Yeah. I do think once they're, and maybe I'm wrong about this. I suppose you've seen so many more of these than I have, just being an emergency. So even just the regurg when they're awake, because they have more control of their airway when they're at least awake versus when they're like under anesthesia, obviously.
Yeah, usually it's just the older ones. The younger ones usually they regurgitate after when they're a little bit older. Like yes, they have more control of their airway, so it's usually unless they're like a smush face breed. That's always the exception to everything I always talk about. But
Or if they have like laryngeal paralysis. But I wonder if that's part of the reason, like because even if they don't have like clinical laryngeal paralysis, have we started to get some
yeah,
weakness of the larynx at that point
I
in time?
think that's
That would
honestly.
sort of make sense, huh?
I think that's what it is because that's always the older dog that they recovered through the surgery fine. They went home, they started eating, then they have a regurgitation episode, and it's usually like one or two. It may not be a lot, but then they're really punky, like you said, the next day. And I
Mm,
think it's an older dog thing. It happens so often. Anything
right.
over the like 8 to 10 happens a lot. So
Oh, well, it's one of those things that, you try to warn people too, and I think that there's so much discussion like before surgery, about okay, these are the things you have to do to get ready for surgery. And that I think sometimes people think that once they come out of surgery, they've recovered, they're awake, they're alert, they're stable, everything's okay, sort of, they seem to be recovering well, that's the end, like that we're done, and I think that a lot of times people are like, oh, okay, you know, I'm not going to see any post-op complications. And unfortunately, they happen. Doesn't it's not a, oh, well, you're a better surgeon or a worse surgeon. It's nothing to do with that. Sometimes there are complications. Every surgeon has them. And it's just one of those things that you have to sort of be ready to deal with. And I have to say, like, I hate when things go wrong. Like, I have very little patience for it. Like, the other doctors I work with are like, yeah, I mean, it happens. I'm like, I know, but it shouldn't. Like, I get so mad when it happens.
that's fine. I know, but it shouldn't. I'm
I
very
know,
true
I
though.
do. I will try to look for any way possible to blame myself for these things, even though I know like there's nothing I could have done to control this, like beyond give Serenia before surgery, or which is what I was gonna say is like now the standard of care to like give antiemetics
Yeah,
as part of your pre-surgical um cocktail, if you
yeah,
will.
it definitely helps. It's just
Oh yeah.
yeah, but I think you got the hit the nail on the head in terms of just prepping owners. Honestly, that saves so many problems down the line. It's like expect complications. If it goes great, it goes great, and everybody's happy. But sometimes there's always something mild, whether it's your dog got the cone off and started licking the wound or the incision site, or they have some post-op illness, which is obviously the focus of our conversation today. So many things, so many things can happen. So
Oh
many
my
things.
gosh, I know. Especially with animals because you can't control them. I mean, like I've taken off so lately I've just had a rash of like mast cell tumors. Like I've just had so many, and I always try to warn people. I'm like, even when you get a full excision, because you have to take so much tissue, and I do everything I can to mitigate tension and all those things, but I can't control your dog's movement. So if
Yes.
you don't keep them calm, it will open. It's going to open. Like if you let them lick, it will open because there is more tension on those wounds. I try my best to mitigate all of it, but like you're taking so much tissue when you're trying to get margins, or a soft tissue sarcoma or something like that. And, I just had one that was like the dog, they were swearing up and down that the dog was not moving. But then every time I saw the dog, it was like jumping up, jumping down, jumping up, jumping down, licking. And I was like, if this dog is doing even a fraction of this at home, this is why it opened back up. And then,
Absolutely.
and it's, but people always are like, well, like they want to blame you. Like, well, you did this. And it's like,
You did this. You did
no,
this. You
I
be listening.
didn't. Like, yeah, I mean, I'm sure that, I try to learn from every surgery. I try to make sure that, each one is better than the last one. And that, like, if there's parts of my technique that I think can be improved, I am always working to do that. Like, I am not perfect of a surgeon at all. I always think of if my mom watched me, like, what would she be telling me? Like, what bad habits do I have or something? My mom's a surgeon. So, and my dad too. So, I was like, I always think, like, what would my mom or my dad think of this incision? But like, some of it you just cannot control biology, and you certainly can't control if people don't keep their dogs calm after surgery, if people don't follow the rules about how to feed them. Like this one particular dog, she was doing really well after surgery. She was starving. Well, they let her just eat a lot of food.
Yep. and then they got sick.
That's
And
where the regurg started. And the thing is like if we had just done maybe a little tiny bit of food that night, let things go, maybe we would have been okay, but maybe not. I really don't know. And I was fully expecting it. Like I was like, this is going to be the one where we're going to be doing some more GI meds after surgery because she's already starting out at a deficit with an abnormal GI tract. You know what I
yeah,
mean?
no, I 100% agree. And it's funny because to get owners to like listen to you, you almost still put like the fear of God in them. And
Mm-hmm.
I found recently, I feel kind of bad about it, but it works. It's just like scaring them financially. And it sounds terrible, but like finance is such a big thing now for so many things. I'm like, for like the back dogs, I'm like, if you do not listen to me, you are looking at like a ten to $12,000 surgery.
Yes.
And always the husband's like, you're not moving. He's like, I'm
Yeah.
always the husband. He's like, nope, we're locking this thing down. Uh, but same thing was like, if you guys don't listen to this, you will spend $3 to $4 more thousand in a hospital being, for these type of things because of complications if you don't listen. And it seems to work a little bit. I feel bad about it, but money talks,
I
I
know,
guess.
and the thing is it does actually seem to make a difference, and I think that is where you're right. Like you do have to kind of scare them, but then the hard part is if they've had it like a surgery before, and they're like, it was fine last time, and you're like, well, that's because we scared you, you know.
Exactly. It's like, just got to warn you the one time. So it's
Yeah, but
just,
it's like certain owners I do think are more worried and are more careful and are more, you know what I mean? And then others are just like, I'll be okay.
we'll figure it out. And we're like,
Whatever. So don't be that owner. Be the
yes,
one that, listens to what your veterinarian says. We say these things for a reason. And if you do have complications, I would say just really listen to what your veterinarian is saying. Hopefully, you have a veterinarian that is like ready, willing, and able to deal with post-op complications. Because I think that's the biggest thing is like when this dog was not feeling well, I was like, bring her back in, bring her in. Let's take care of her. Like, I am not going to sit here and tell you, oh, don't worry about it or do this or do that. Like, I'm like, bring her in. We're going to help you out. And, it's frustrating when people choose not to come back in. And then, they want to keep calling and asking you what to do. And it's like, bring me
come
the
on.
dog. That's what we should do. But if your vet isn't doing that, isn't, don't just like go find one that is. That's what
Yeah.
I would say. Like go to the emergency clinic and find Robert. If you don't have a veterinarian that's able to deal with post-op complications. But what makes you a good surgeon, what makes you a good doctor is dealing with your complications because they will happen, and that's the
Yeah.
difference between a good doctor and a bad doctor. It's not that they have complications. Everybody has complications. It's how you deal with them.
Absolutely. And like I said, especially if your pet's older, be proactive. Just be aggressive about it because it will get prolonged if you're not. Odds in
Yeah.
most cases, you aggressive. Like if your vet tells you to come in, go in. Don't be like, oh, we're gonna wait and monitor for a little bit because you are the one that's gonna come back into me in the middle of the night because your dog won't stop regurgitating. They're dehydrated. We need to put them on fluids for 2 days now instead of you spending maybe a day of hospitalization where it's cheaper at your vet.
Yeah.
Like I promise you, just listen.
Yeah.
That's older. Listen,
Yeah,
because
and also too, I mean, like even if there's a chance they would have been fine without it, if they went and they got it, it's not going to hurt them. You know what I mean?
exactly.
Like, so it's like there's no downside to doing it. You could only have an upside. And then at least we're checking their pain, we're checking their incision, we're checking like all those things that you're not really, unless you are yourself a nurse, a doctor, or something like that. But even then, there's differences. And so, I mean, I'd say listen to Dr. Robert.
And listen,
Bring your
Dr.
dog
Sam.
in.
Listen to both of
But
us.
yeah, I think that's pretty much it. But also too, don't get too upset with complications. Just sort of expect them, like you said. I think that's the other thing too. The other takeaway is like they happen.
Yep.
It
Everybody.
stinks when you have to do something like get a mass removed because of surgery or get a bunch of teeth removed. It's part of owning a dog, it's part of owning a cat, and it's a necessary evil. This dog was teeth were falling out of her head. Like we just didn't have a choice. And so yeah, she was older. She was like 14, and and that is always a hard thing because I'm like, yeah, but she could live for another 4 years. So then at 18, her mouth's going to be even worse. And I've had that happen where we've had dogs where we're like, oh, I don't know, they're kind of old. Should we put them under anesthesia? And then they live 2 more years with a horrific mouth. So, it's always a judgment call. But everything's a little bit of a judgment, I guess isn't really the word. And
Yep,
then, you know, um, just expect complications and, like you said, be happy if they don't happen.
exactly. So these are the wise words of Dr. Sam and Dr. Robert.
Exactly. But I think that is our topic for today. So I enjoyed this one. I feel like it made me feel a little bit like it's what I'm dealing with at work. So it was sort of like a therapy session a little bit.
This is what our weekly sessions are turned into: therapy sessions, and
Exactly. Like
I need to.
triage what you're seeing at work and see if you agree. Because maybe we can learn. I do. I learn a lot from you. So I actually really like when we talk about these things because I'm like, oh, I like either I'm doing things right or maybe I need to rethink it. I don't know.
I agree 100%. I actually had to call you the other day for a bunch of general practice advice because I'm starting to take general practice shifts. So, and she gave me my own spiel. So thank you.
I did. That's true. We were on the phone for like 35 minutes almost. You're probably
I
like,
was
all right,
like,
this is enough.
the thing I've never had talk about. I was like, oh my God, this is such a good idea. Why have I not brought this up before? So it's, I just realized how different those conversations
Yeah.
are. And I appreciate you. So thank you for helping me be
Oh, anytime.
educated.
It's a total shift from like preventative medicine is totally different than like, and I have a hard time like taking that hat off when I have an emergency come in that has like eight other things that I'm like, but we didn't deal with this, and this, and it's like, but this is the thing that's going to kill him. So let me deal with that right now. You know what I mean? So it's like I'm so like preventative hat all the time that I have to like try to remember take that hat off.
I'm all reactive. I'm better with reactive apparently. But have we done like a new puppy podcast? Like
I
I feel
think
like
we did long ago in the beginning, but you know what? Let's look back and let's see.
that might be a good one.
And
I learned a lot.
otherwise, what do you say?
I learned a lot. So you can pretend like I'm the owner. I'll ask some basic questions that I would
Oh
hear, and you
yeah. Yeah, let's
know what
look
to do.
back and see because I feel like we talked about maybe like breeds or like how to pick breeds, but I don't know if we ever talked about like, hey, I just got a puppy. What do I do?
Exactly. I think that'd be a good one. So I got a couple ideas now just from this podcast alone. God, it's so great talking to you. So
Well, hopefully everybody else enjoyed us talking to each other. And thank you all for listening. This has been the Pause It Podcast.
that's so.